Hello everybody, I am Dr. Siddhesh Dhaygude. I am consulting nephrologist working in this field since 2006. Now we will discuss something about kidney transplant. Kidney transplantation is a modality provided to the patient who are having permanent kidney injury or kidney failure and are dependent on the dialysis for their life saving. Kidney transplant is What is kidney transplant? Kidney transplant is a procedure or operation that is done in which there is kidney which is taken either from the live related donor or cadaver donor and that is implanted inside the patient's body. Once this operation is done, then the success rate of the operation is around 95%. I would not say that all the operations are successful, some do fail, but overall success rate of the operation is really good. It is the ideal modality that is provided for the patient and once that is successful, we can stop the dialysis and patient can go back to their normal lives in the future. Now, we can see it in 3 steps. First, pre-transplant evaluation, second, actual transplant and post-transplant period. Transplantation involves somebody else's organ to be implanted in the body. So, we have to have a donor safety first. So, we evaluate the donor before we accept him as a donor. We examine him beforehand, he or she undergoes battery of investigations. At every step, it is ascertained that donor will not have problem in the future life and then we will accept her or him as a donor. Once we get the permission from the authorization committee, we proceed to the transplant. During transplantation, patient will receive few immunosuppressive drugs which need to be continued till the kidney is functioning. In the initial part of the transplantation, the doses of the drugs will be on the higher side. Later on, as the kidney suits or depending on if the patient gets infections or depending on the clinical situation, we might modify the requirement of the immunosuppressive drugs and over a period of time we reduce the doses of the immunosuppressive drugs. Overall operation approximately you can say lasts for around 3 to 4 hours including donor and recipient. On an average, the stay in the hospital is around 7 to 10 days depending on the clinical situation and need. Donor nephrectomy is done in 2 ways. One is laparoscopic donor nephrectomy or open donor nephrectomy. Depending on the procedure that we choose, the stay of the donor will be around 7 days to 10 days in the hospital. In case of a laparoscopic donor nephrectomy, the pain and stay in the hospital is less. Once that operation is done, we come to the post-transplant period where the patient is observed over a period of 8 to 10 days inside the hospital. Monitoring of the drugs level is done. Depending on the urine output, clinical parameters, the patient is discharged on 8 to 10 days. After that, patient will require regular medical follow-up in the nephrology clinic and he or she will require modification of the drug dosages and monitoring of the clinical parameters like urea, creatinine, urine routine and hemogram as well as tacrolimus and MMF, that is mycophenolate drug level. Intraoperatively, some patients receive hemoglobin as an induction agent, some patients receive basiliximab as an induction agent and few patients without induction which directly use steroids, calcineurin inhibitors as well as either mycophenolate mofetil or azathioprine as an immunosuppressive drug regimens. Overall, the success rate, as I said, is 95%. However, few kidneys will work for 1 year, few kidneys will work 3 to 5 years and few kidneys will work more than 10 years. Now, what will decide about this life of the new kidney? It's the match of the donor, how many comorbidities patients have, are there any problems in the donor while donating the kidney, is there any rejection of the kidney by the recipient's body, and is the patient taking regularly medications. These all things will decide about the life of the kidney. Also, the age of the donor is also important factor that need to be considered, as elderly donors may have little less allograft survival. Thank you.